Hello everyone, Assalamu alaikum. This is Mohammad Rasheed from the American Accreditation and Jeon Foundation. We welcome you to the third video of our community awareness program, where we pick a topic on national and international healthcare issues to discuss with highly regarded healthcare professionals in the UAE. Our topic for today is Alzheimer's and brain awareness. And we have Dr. Girish Banwari as our guest today. Welcome, Dr. Girish.
Thank you so much for having me here.
Thank you for accepting our invitation. Dr. Girish is a psychiatrist with over 15 years of clinical and academic experience in specialized psychiatry and mental health facilities. And he's also a member of the Royal College of Psychiatrists in the UK. Dr. Girish, today we'll be talking about Alzheimer's and brain awareness. And I just studied a statistic when I was preparing for this video, that one in every 6 people over 85 years of age, they have Alzheimer's. So what is Alzheimer, basically?
All right. I think all of us know a lot about Alzheimer's, but a lot of us don't know what it exactly is. So Alzheimer's disease is a form of dementia. Dementia is a generic term used for a set of conditions characterized by loss of cognitive capacity, typically affecting memory, but also other aspects of the brain function, such as thinking and reasoning, planning and organizing, as well as emotional and social abilities, to such an extent that it interferes with the person's daily life and activities. Now, Alzheimer's is the most common cause of dementia. It constitutes 60 to 70% of all cases of dementia. And apart from cognitive dysfunction, it is common for people with Alzheimer's to have behavioral and psychological changes such as depression, anxiety, paranoia, hallucinations, agitation, even personality changes. And unfortunately, Alzheimer's is a gradually progressive disease that worsens over time.
So basically, since I was younger in age, I had this fear of maybe I'll get Alzheimer's when I grow older, because I'm very forgetful, all right? So basically, do you think that forgetfulness at maybe a younger age is one of the reasons why people may get Alzheimer, or one of the symptoms?
Forgetfulness at an early age may not essentially be a marker for developing Alzheimer's or any form of dementia later in life. You might or might not develop dementia if you have forgetfulness at a younger age. There are several different causes of forgetfulness when you're young. It could be stress, it could be anxiety, it could be vitamin deficiencies, it could be a thyroid problem. So all of these are correctable or reversible causes of forgetfulness. They don't essentially predict your risk for developing dementia later in life.
All right. So when basically does it start? So when do you say that Alzheimer's has started for someone, and maybe they're now suffering from Alzheimer's? Because I understand that it's a degrading kind of disease. That's the right term. So basically, what we're trying to do is to prevent that degradation from going so fast and maybe stop it. So when does it usually start? And when do you think that, okay, this is a patient that has Alzheimer's?
All right, but I just mentioned a few symptoms that the person with Alzheimer's disease has, which are typically seen in people over the age of 65. 1 in 14 people over 65 have the disease, and the incidence and prevalence only increases with the age, so that, what you mentioned, 1 in 6 people over the age of 80 have the disease. Rarely, the onset might occur before the age of 65, which is then called early onset Alzheimer's. Right? It's normal for people to forget things once in a while as they age. The serious memory problems in a person with Alzheimer's disease make it hard to do everyday things, such as driving, using their phone, finding their way home, even basic self-care. Mild forgetfulness is often a normal part of aging. Most people would become mildly forgetful as they age, but dementia is not a normal part of aging, or any form of dementia, including Alzheimer's, is not normal, as it has serious memory problems that lead to major impairment in function.
Yeah. So basically, you can discover if someone has Alzheimer's when they develop these kind of symptoms, right?
Right.
Is there any other way to like early kind of detection of the disease, or that's the only?
We don't have any specific investigations that would help us detect cases early, so we just need to keep a watch. There are certain risk factors though, and age is the biggest risk factor. And as you age, you increase your chances of developing or having the disease. But apart from that, other risk factors would include having a family history of Alzheimer's disease, having Down syndrome, having cardiovascular problems, having history of brain injury in the past. So all of these factors increase your susceptibility to develop Alzheimer's eventually. But there's no specific test. Even if you do a CT scan, it would just show a shrinkage of the brain matter, but that essentially does not characterize people with Alzheimer's. Even normal aging would lead to a mild shrinkage of the brain. So you don't have any specific tests that would tell you that you would, or you do have the chances of having Alzheimer's disease.
Understand. So basically, it just goes to back to the family. I mean, they have to be aware of what's going on, especially with the elderly, to make sure that they if they see any kind of symptoms, they can act. So, doctor, do you think that modern life contributes to as a cause of this Alzheimer's disease to happen? Actually, is there any correlation between modern life and maybe how many people got Alzheimer's or any statistics like that?
We're not very sure here. See, Alzheimer's disease is thought to be caused by an abnormal buildup of certain proteins in and around brain cells that leads to death of the cells and shrinkage of the brain matter. Now, what exactly triggers Alzheimer's is not very known. Know that certain lifestyle factors or environmental factors might have an influence, but the linkage is not very clearly established.
Yes, yeah, understand. Our last question today is, how can it be treated? Can it be treated or prevented? And what will be the role of the family here? What should the family do to support Alzheimer's disease patients?
All right, like I just mentioned that the exact cause of Alzheimer's disease is still unknown. And just because the cause is unknown, there's no certain way to prevent the condition. But gaining a healthy lifestyle can help reduce your risk. This would include exercising and eating well, getting enough sleep, engaging in activities that stimulate the mind and the body, stopping smoking, reducing alcohol intake to a minimum, preventing and controlling high blood pressure and diabetes, detecting and treating depression if the person has it. So all of these will help prevent, if not the onset, at least the progression of the disease. Now we have certain medications that might help slow down the progress of the disease, but there's no medication that can reverse the illness or completely cure it. Yeah. So to answer your first question, and then you asked me what role does a family member have in caring for a person with the diagnosis. So I think the most important thing to do as a family member is to be there for the person. The person with Alzheimer's disease will soon be lost, alone, and sad. By being present, the patient will receive your attention and love, not just from you, from other family members as well. And this will be of great comfort over time to ensure that the patient is safe. They're not leaving home without informing someone. They're not putting themselves at any sort of risk. The chances of falls, the chances of injury is high. So as a family member, it becomes your responsibility to ensure the safety of the person. You can help the person follow the daily routine, plan tasks for them, help them make to-do lists, use memory tools such as calendars, notes, keep the instruction and language that we use with them simple, just for them to understand. Put the important things such as wallets or purses, keys, phone, glasses in the same place so that they don't struggle to look for them all the time. And most importantly, rather than criticizing or abandoning the person, provide them the emotional support, comfort, and care that the person needs. And I think that would go a long way in helping.
So basically, organizing, that's actually a very nice point, and I like that. You kind of try to organize that patient's life for as much as possible so that they don't get confused what's going on. So basically, they're going to be forgetful. They're going to be, not knowing what's going on for some reason. Maybe when they go out, they might lose the way back home or something. For some reason, basically, you're going to try to organize their life for them as much as possible and make certain patterns so that they kind of get used to it and then stick to it. Thank you so much, Dr. Girish, for joining us today. It was really a nice and informative session, and hopefully we can have you in future, inshallah, awareness programs with us as well. Thank you so much, really, for joining us.
It was absolutely my pleasure.